There are a number of questions that were about health issues in general, hypertension, people who have high blood pressure, people with thyroid problems, people with chronic fatigue and fibromyalgia, a lot of patients out there that inquired, is this diet appropriate? And the answer is, it absolutely is appropriate. There are very few people that I would say this diet is not appropriate for. If you really had to peg me for something, I would say a type 1 diabetic should be a little more cautious when you're on this diet. Primarily, as you know, those people who are type 1 diabetics, there has a tendency for the sugars to go up and down rather drastically. The whole idea of this diet is a very healthy diet that really any diabetic should follow, type 2 and type 1. Now, for a type 2 diabetic, it's really something that's absolutely perfect. You may find yourself over the course of several weeks reducing your blood sugar medications, whatever they may be. Some type 2 diabetics are on insulin, and you may find that your insulin needs drastically reduced, if not completely go away. So the idea for diabetics in general is basically that you want to do the diet, but be cautious about doing the diet. Checking your sugars regularly is very important. We got one question about a young lady who was on an insulin pump who was type 1 diabetic. Again, same thing applies. Now, if you're on an insulin pump, this is great, because the ability to titrate your sugars, we all know how these insulin pumps work. You can sort of dial in what you're going to need based upon what your foods are and what your sugars are. Take-home message is, this diet is absolutely appropriate for everyone. If you're a diabetic, type 1 or type 2, you're obviously going to want to be a little bit more cautious about checking your sugars and just being aware of where you are. But you're going to see your medication needs probably start to decline, especially in the type 2 diabetics. We're doing a lot of treatment of type 2 diabetics now with insulin. We're finding that controlling that sugar is much easier with insulin. This diet is going to help you do that and help you perhaps reduce your medication needs.